This is QD Clinic, stills or not. Hi, I'm Jack Cush with Room Now. Today's case, a 30-year-old woman of mixed race shows up in my clinic. She's got 7 months history of joint pains, muscle pains, lymphadenopathy, non-painful urticaria, and daily fevers that can go as high as 104, usually around 102. She says she gets these fevers without any particular pattern, meaning any particular time of day. But generally she has fevers most days, but not all days, but generally most days. Confusing, but that's the best she could give me. She has a history of sleep apnea, migraines, fibromyalgia, and eosinophilic esophagitis. When I see her, she's on, another rheumatologist has put her on methotrexate. She's taking gabapentin and duloxetine. On exam, there is no rash, there is no lymphadenopathy, there is no hepatosplenomegaly. She has a number of tender joints and tender points, but no swollen joints. There is urticaria on the trunk and extremities. Labs reveal a white count of 17,000, the hemoglobin of 13. Platelets were normal, chem profile was normal. The CRP was elevated at 19 milligrams per liter. The sed rate was 50. The ferritin was 1,280. Normal complements, negative tests for Hep B, Hep C, EBV, ANA, and rheumatoid factor. Immunoglobulins were normal. We did a 24-hour urine and a UA, that was normal. The aldolase was normal. The ferritin, again, on repeat, was still elevated. Uric acid was normal. CK was normal. So in seeing her, her CRP always bounced around in the high range of 15 to 25 milligrams per liter. And she had these fevers despite being on methotrexate. Still's disease or not? I guess we could go to the criteria. Does she meet quotidian fever? Not really. She has high fevers, but not quotidian fevers. Does she have an evanescent rash? Not really. Does she have simultaneous elevation of white count and sed rate? Yes. Is she seronegative? Yes. That's 4 points on Cush criteria. Is she age less than 35? Yes, 5 points. Does she have liver, spleen, lymph nodes, LFTs? No. Serositis? No. Cervical, tarsal, carpal ankylosis? No. Prodromal sore throat? No. So she's sort of stuck. Even though she's got inflammatory markers, she's sort of stuck short of the 10 points needed. I think she got to 8 points total. A diagnostic test was done, as they do in the New England Journal CPCs. What was that diagnostic test? That was an SPEP, serum protein electrophoresis, where she was found to have a biclonal gammopathy. And that was enough to cinch the diagnosis of, yes, you guessed it, the daily febrile syndrome that can occur in adults, with onset in adults, Schnitzler syndrome. You never heard of it, did you? Schnitzler's, Schnitzler. Again, the clue here is the finding of non-pruritic urticaria, an IgM mono or polygammopathy. Again, key features are fevers, usually less than 104, arthralgias, arthritis, bone pain, lymphadenopathy, can have a hepatosplenomegaly, will have a high white count and inflammatory markers, and because of the inflammatory cytokines, will get anemic and may even lose weight. Pancreatitis is a sometimes complication of this. It's thought to be a form first of malignancy, especially the plasmacytic malignancies, something like Waldenstrom's. In fact, Waldenstrom's develops in up to 15% of patients. So these patients with these abnormal SPEPs and gammopathy mono or polyclonal gammopathy should be followed for malignancy, evaluated for malignancy, and then treated as if they have an autoinflammatory syndrome. They respond incredibly well to IL-1 inhibition. So anakinra, canakinumab, even rilonacept would work well. But it does not change the monoclonal gammopathy, meaning their symptoms will get better, but that gammopathy is always going to be there. There has been I think a trial of canakinumab in these patients. I think that they did well, complete responses in 5 out of 7 canakinumabs, and none of the patients that were treated with placebo in a small 20-patient trial. So again, consider it. It's one of the conditions that has its onset in adults and has a daily fever. Interesting, no? Tune in for more, Stills or Not.